Hey there, welcome to Crew Talk by Health Crew HQ. I'm Shelby Barker. In the world of digital health, there are thousands of pitches flying around every single day. I mean, you guys are getting bombarded with them constantly. It can be hard to know what's real, what the white noise is, and Health Crew HQ is all about helping leaders sort through all of that stuff. And one of the ways that we do that is right here on Crew Talk. Our goal with this short little podcast is to help us search and explore innovation beyond the pitch. So let's get into it. Today, I'm sitting down here with Sam Smith, CEO and co-founder of Amissa. Sam, thanks for being here. Awesome. Well, why don't we get to know you a little bit? What are you watching, reading, listening to? I know you're listening to this podcast, but what other things are going on?
Oh man, watching. That's a good question. The Boys, I guess, is probably the background, a tough background show to watch, to be frank.
Yeah.
But like I mentioned to you earlier, I don't actually take breaks. So it's typically I just run shows in the background and pick up snippets. And I think snippets of that show is probably
most reality shows. That's probably all you need to get.
Yeah. Any show, to be honest.
For sure. I watched Love is Blind, and when you get to the end, do you ever watch that?
Oh, the earlier seasons, I don't think Love is Blind.
Yeah, that's what we learned. When they get to the end and it's the wedding thing, I'm just fast forwarding everything. I just want to see if they say yes or no.
No, you can pretty much call it. So yeah. I should have mentioned a book just to make myself sound more educated.
That's true. What are you reading?
Oh, right now Corduroy at night with my daughter. But that's
okay. I was like, wait, a kid's book? Okay, nice. Well, that does make you sound sophisticated.
No, Estrogen Matters is a book I have on my bookshelf. It's about menopause. So obviously a topic of choice that I love to dive more deeply into.
Love it. Well, speaking of that, some stats to kind of level set us here this afternoon. Did some research, 26 billion annual hit to U.S. employers and health plans. Nobody's measuring it well. 20% of the workforce is, in some is a stage of premenopause or menopause. You've got symptoms showing up in claims, a lot of disconnected items there, sleep, MSK, GI, all that stuff. So when you look at this landscape, what got you into it? What made you want to jump into menopause? And I guess before you do that, just talk a little bit high level, elevator pitch. What is it that you all are doing? And then how'd you get into it?
It's bleak out there, is it not? I think the positive thing in startup world, or what you always look for in is this startup a startup worth paying attention to, is timing. That's the hard thing to capture, the thing you can't manufacture. Menopause is not only having a moment, it's having a movement, especially if you consider how our conversations go with health systems, particularly around a look at the success of someone like Amissa, who just has billion-dollar valuation in serving a completely underserved market. Like you mentioned, 54 million women in the United States suffering from menopausal symptoms, recognizing they don't need to suffer any longer, looking to their OBGYN PCP for support. Those folks feel, 93% of those individuals feel as though they are not equipped to manage menopausal symptoms. 2 reasons: lack of knowledge, but also a lack of technology support. Obviously not all their fault, but it's really the problem that we are coming in and looking to solve. So Amissa focuses on supporting clinicians by organizing their menopausal patients' symptom data and enabling them in a few different ways. 1, symptom tracking is necessary for care, and they haven't had the technology to organize it. 2, patients feel validated. They're being heard. They're being seen with more efficient conversations that can lead to shorter visit times or better coding potential. So it's a really complex system, menopause, 40 symptoms across the entire body, hot flashes, your cardiology, your heart palpitations, anxiety being the leading symptom in perimenopause that affects a bunch of different specialties, leaving women very confused, going to folks who aren't able to validate their experience. We enable an easier education, not only from the patient experience, but the ability to gather this information and help inform those specialties leveraging AI.
Okay, so I need your opinion. I mean, it's not like menopause is a new thing. Why has it been so invisible in healthcare for so long?
Yeah, I think it's two reasons, and this is also your timing question. One is there was a study back in 2002 that lots of thoughts, and you can dive more deeply into it from WHI, that led to a black box label warning on hormone therapy. And there was a huge drop in the usage of hormone therapy, which is one of the best ways to help resolve or help alleviate menopausal symptoms. Many of the tides have changed as far as the understanding of how that can support women. And then the introduction of an understanding of what perimenopause, menopause is, and a movement around women who are recognizing that suffering is not a prerequisite for living or being a woman, especially if you think that 20% of the workforce is considering leaving simply because they're suffering so much from their menopausal symptoms. So when you think about menopause and the effects it have, 70% of midlife men and women blame their divorces on menopause.
Dang.
It affects every part of your life. And women are just deciding, you know what, I'd rather lean on the data, the research. The black box label was recently removed. And now there's this huge influx of interest among every health system that you talk to. One that I spoke with yesterday was they have a 10-month waiting list for their menopausal patients. That's revenue, literally finding alternative solutions because no one's going to wait that long.
So if you're a benefits leader, I mean, maybe today, but it sounds like 10 years ago, you might be seeing elements of menopause come through as mental health claims, other things that you're maybe not able to connect the dots for, and that's where you guys come in?
100%. Yeah, exactly. Trying to organize the information in a way that makes it easy for any type of clinician to digest exactly what that woman is experiencing in midlife, and using validated assessments like the menopause rating scale to understand symptom severity. The AI on top of that, and especially like where we see our whole moonshot mission is how do we get evidence-backed research involved in that readout to enable any type of specialist to better understand how menopause is playing a role in that woman's life.
So you are typically partnering. Walk me through it. There's clinicians that are involved. How does it work from your end?
Yeah, from our end. So we're focused specifically on servicing clinicians and working with health systems. We're live in practices today. The way that it works is in technology, it's really depressing if you think about the lack of technology that existed that has created the opportunity for us to step in. But something as simple as we enable a ability to collect menopausal symptom information with a validated assessment to start. They're introduced to the Amissa app, which is an Android or an iOS app where they start to do daily symptom logging. And then they're also allowed to connect their wearable device. So we pull you're in your Apple Watch, your Aura, your Whoop, Garmin, etc. The core thing that we've heard, we've interviewed and spoken with and have served over 500 clinicians, patients, researchers is I don't want more data. I want data that I can leverage for care. So we create a clinical summary that enables that clinician not only to see that longitudinal information in one place, but also trends over time, which is necessary not only for documentation and reimbursement, but also for titration and care. On average, you see about 3 menopausal visits to be able to get to at least some semblance of a care plan. That's because it's complicated. Menopause is not easy to solve, and we're here to support and figure out how we can use data and evidence-backed care to help really make every clinician a menopause specialist.
So I'm very naive about this. What is the thing that is triggering? Okay, in my mind, you're thinking before benefit leaders are maybe looking at mental health stuff or you got hot flash, all these different kind of random things. What's the thing that would trigger a clinician to say, "Oh, okay, I think that this may be perimenopause or menopause"? Like what are some things that would trigger this?
Yeah, it's a myriad. It's a bunch of things all combined into one with that clinical lens. So it's the range of symptoms over time,
Okay.
which is why the longitudinal information is so important, really factoring into the ability for them to assess exactly where they are in that specific stage. So clinical guidance and intervention is always going to be needed. And we just support with the decision-making process by enabling them to do that. This is something that when you talk about AI, which I know is if you don't mention AI in a sentence, are you breathing? Eh, we not only lack the research to fundamentally support any type of like AI agent to step up in this capacity to help, the EHRs as they exist today don't have the fields to track these menopausal symptoms to make the appropriate assessments. So what is women's pain is our opportunity, obviously, and enabling us to be able to create a solution. And that is the technology layer to collect this data and surface that information in a way that's actionable. We've been called by one of the leaders at Aura the plumbing of menopause. Which no one thinks is catchy but me. But it's memorable. Like, we were just that data infrastructure layer. Is it possible to provide care?
So, and they're getting some, what type of results are these clinicians getting? I'm sure there's some financial elements to it, better patient care, obviously. Talk about that a little bit.
Yeah, the ROI factor of simply organizing data hits a few different arenas. One is patient satisfaction is a big one that I was surprised. I'm like, of course you guys care about patients. Clinicians want their patients to feel heard and validated. That was number one. Number two is you're hearing from large health systems, I wanted to make my appointments or visits more efficient so we can fit more in a week. I also want to be able to code appropriately. So the documentation supports that, so you're not typing into the notes and it's getting lost in the notes each of these individual symptoms. Again, there are 40 in rank and severity and timing, which are all necessary to provide care. And then lastly is that time that you're taking to chart. Many of the organizations I'm speaking to, these menopause cases are so complex that they're like being able to educate that patient on what is menopause, pull the information about what they've been experiencing. Like, tell me what you had last week for breakfast is the same type of questions that, like, when was the last time and how frequent are your hot flashes? Do they typically occur? X. And then put that across 40 symptoms. The pajama time or the time necessary to chart that information to hit not only the care measurement you want to hit, but the documentation for coding. We alleviate that just simply by organizing data that exists.
So when you go out and you're talking to these different providers, different benefit leaders, whoever the audience is, who's the hardest sell, and what's the objection that you're hearing?
To be honest, what's nice about, and my background is in sales, sales and startups. This is the first company that I haven't had to find very creative ways to sell. You have the folks holding the purse strings, seeing revenue walk out the door with MIDI, taking their customers. Like, that's a narrative that I don't have to say. They understand and they're trying to solve for it. I think if you did a Google alert on the number of menopause programs that are popping up across the country, like, that somewhat shows that this is a revenue generating opportunity. The clinicians are being burnt out. Many of them are actually pushing and going towards concierge practices where they feel like they have enough time to have conversations with their patients, and they also have demand. So there's very clear narratives across the ecosystem. I was called a dreamsicle yesterday by a and I was like, I can send the notes. I had the AI recording.
Yes.
But that was the word they used. Was, well, it sounds like a dreamsicle. I was like, I'm going to get that tattooed somewhere.
You've got plumbing, you've got dreamsicle. I mean, you're covering the whole thing.
It seems like, and she, quote unquote, she's like, it seems like an obvious win.
Yeah.
Like, why wouldn't we do this? And I mean, it wouldn't be my job if I didn't make it seem that way. As far as the hard part, because this is such an underserved market and we're the only one focusing on this B2B component, enough of a land grab that it's more, the argument I can make is like someone doesn't understand menopause and the opportunity. We haven't run into that yet, just because it's really easy to focus on if you have a women's health group, they understand this problem and I don't have to womansplain it to them. And then leadership is just recognizing the dollars behind it. So I'm trying to think of a negative.
Well,
epic integration. And
yeah, I was going to say, there's some sort of technical epic thing or something.
But we don't need it. So like the pilots that we're orchestrating around actually doesn't integrate directly into the EHR. We leverage facts to push our clinical summary. It's sexy if you're really into facts. But really what it enables is, because like I mentioned at the top, the EHR doesn't have the fields for me to push this data anyways, putting it into the media file would most likely be the area this data would go to. We're enabled to do that right now. We don't have to directly integrate, which means our sales cycles are shorter and time to pilot is quicker.
Love it. So I always kind of end, we're in it for the people. There's great ROI stories, there's great financial savings stories, that type of stuff on these innovators, but we're in it for the people. So do you have a clinician story or a patient story that you all came in and it just changed their life?
Oh, first of all, I love that because the stories are what I like to, and like follow me on LinkedIn. I just posted a bunch of quotes with some of the stories that we pull out. But no, I think core to what the problem that we're solving is a human problem. I get notes from sell to clinicians. So the notes that I get from the people using us is always delightful. And it's I don't know why that always comes top of mind. For me are the patient stories of I've been seeking. I went to 5 different providers to try to find help, like being heard and seen, and seeing my the care plan relating to me specifically, and like what I'm experiencing is such night and day compared to what I had before. I had someone who messaged me yesterday. She was a bodybuilder suffering from like muscle atrophy and like issues around that, and how she was telling me like integrating her wearable data into the view for her clinician was very important for her. Now clinicians have a different feeling on wearable data, but really it's we're servicing 2 people if you think about it. Their missions are the same. Getting to the end of the day is actually quite different. The patient just wants to be heard. They want to understand what's happening with their body, and they want to feel connected with their clinician in a way that they know that this effort and this suffering is going to end soon. And we really facilitate that simply by providing a medium to communicate it. The clinicians just want a one-page view of what is happening so that when they're having a conversation, they can actually get to the point and get to that effective care plan efficiently. The stories that I have mostly revolve around that.
That's awesome. Well, Sam, I think you guys are filling a big hole that I don't quite understand, but I appreciate you doing the work. And it's obvious, as I talk to health systems, I mean, it's obvious that it's definitely a need. I mean, the number that I keep going back to in this whole conversation is that, what was it, 93% of OBGYNs? I mean, that's crazy.
It's depressing. And they know it too. I've pitched OBs before, and they were like, is there any way you can bring your medical advisory board on so they can tell me like how I would use this? And I was like, ooh, that is a very depressing learning. But yeah, I have to eat my own dog food and believe my own stats. So yeah, it is depressing. But hey, if you ever need me to, just text me and I'll answer any of your questions. If you
love it. Thank you. I appreciate that. And if you are trying to get connected with Sam, let me know and we'll be glad to get you connected. And I'm sure you can find her on LinkedIn. She's already made that as an option. What's the website for you all?
It's Amissa.com.
Sweet.
And I can spell that out, but I'm hoping it's going to be right there.
Yeah, we'll put it up somewhere. I think we'll put it up. Yeah. Well, cool, Sam. Thanks for joining us, Crew Talk. Everyone, hope you guys have a good day. We'll see you next time.
Thank you.